Hey, it's Sarah Smerz with 98.7 WNNS. So, Mental Health Wednesday, we always talk about how to stay healthy. I know we talk about things physically a lot, but how can we stay healthy mentally? Well, thankfully, we've got Dr. Dobbins at SIU here today. She specializes in behavioral health, psychiatry, child and adolescent psychiatry, as well as telemedicine. Welcome, Dr. Dobbins.
Good morning.
All right. Thanks so much for being with us today. We really appreciate it. So, again, we talk about physical health all the time, but we don't often talk about mental health. Can you explain a little bit about the importance of mental health?
Mental health is probably one of the most misunderstood topics that people have. It has been interpreted through what people see in movies, and there's kind of a cultural stereotype that kind of sees it as a personal weakness and kind of blames the person. But if you think about it, mental health really is a form of physical health. It is how the brain is functioning and how it works. Now, the brain processes are complex, so it can come out as mood, self-regulation, attention, thinking processes, and all of that. But it really is all about keeping the brain healthy.
All right. And can you explain a little bit about anxiety, depression, kind of what the differences are with those two?
Well, anxiety and depression are mood-related problems. It's interesting because what we have really learned over the last, especially 15 years or so, is that our experiences actually change how our body functions physically. And what happens a lot is that our experiences, if they are not kind of the healthiest experiences, they kind of over trigger our stress response and kind of set up this chronic inflammatory reaction through not only the brain, but all the other systems of the body, and changes how our DNA is expressed. And that tends to drive symptoms of anxiety or worry or nervousness, feeling unsafe and insecure, which oftentimes is associated with or drives depression, having a low mood, not having energy, not being motivated, feeling down about yourself. So these are actually changes in brain processes.
Now, a lot of celebrities I've seen have been coming out of the woodwork lately, especially talking about bipolar disorder. Can you explain a little bit about that?
Bipolar disorder is probably one of the mental illnesses that is really misunderstood. A lot of people commonly believe it to be mood swings, and there are many, many different things that cause mood swings. Bipolar, or the other name is manic depression, is really kind of a spontaneous change in the brain where you get really, really energized on the one hand, or really, really low energy, typically depression on the other hand. The energized episodes can be very different from person to person. Sometimes they're associated with kind of euphoria, and sometimes it's really intense irritability or anger or even anxiety, but it is uncharacteristic for the person if they weren't in one of those energized episodes.
All right. And I've heard people say that medication for a mental condition is just like taking it for high blood pressure. Do you agree with that statement?
Oh, absolutely. I think this is another thing culturally a lot of people are afraid of, that especially for movie representation, that medicines are to dope people up or alter their mood for them or to do something artificial that won't make them them. But if you really think about it, the symptoms tell us where you aren't healthy, where the brain isn't functioning as it should. So the purpose of medicine is to get those areas functioning in a very healthy way. A lot of medicines on the market, if they're done well, you should not feel medicated or really feel like you have to put up with much in the way of any chronic side effects. You should just gradually be feeling better over time.
All right. And what services does SIU provide?
I am located in SIU Department of Family Medicine. There is a psychiatry department as well. But the reason I'm in family medicine is because these are physical illnesses and they are part of a person's whole health and well-being. We know that treating the anxiety and depression, those chronic inflammatory responses, help prevent long-term diabetes and heart disease and things like that. So in family medicine, we have a group of both therapists and psychiatrists. We call it integrated care. We do screening, we do some background history information. There's a little bit of ongoing therapy that we do. We do more in-depth psychiatric evaluations. We really work to try to work as a team with primary care providers to provide kind of holistic health for patients.
All right. And for our viewers, you can get more information at siumed.edu or 217-545-8000. Dr. Dobbins with SIU, thank you so much for being with us today.
It is my pleasure. Thank you.